Hello, everyone. My name is Bindu Raghavan, and I work as principal scientist in the Wildlife Disease and Community Health Program at the Center for Wildlife Studies. The Center for Wildlife Studies is a 37 years old nonprofit organization specializing in wildlife research, conservation policy, and education. We are an internationally recognized center of excellence in the areas of wildlife research, in situ conservation, policy, and education. Our scientific research-based conservation programs have won awards and acclaim nationally and internationally. In this respect, the research work carried out by our doctoral students and young scientists is extremely important and vital to the on-ground conservation work that we do. They need your immediate and generous support to carry out these studies and to be able to make a difference. If you would like to be a part of this process and make a difference to wildlife ecology and conservation in India, please visit this page and check out all the interesting work being carried out by our young scientists. Choose the one that best speaks to your heart and support with the contributions you feel most comfortable with. Coming back to today's webinar, welcome to the 52nd episode of CWS Wildlife Chronicles. Until 2020, we used to host these talks on the latest topics in wildlife science and conservation in our Bangalore office. Post the COVID-19 pandemic, we have instead been conducting these webinars as a series of webinars. So far, our webinars have covered a wide range of interesting topics such as public health and zoonotic diseases, tigers and elephants, snake bites and bioacoustics, etc. You can visit our YouTube channel if you want to view our previous webinars. Today's webinar will also be recorded and you can access it on our YouTube channel if you're not able to see it through completely. Today, on the occasion of World One Health Day, we will be discussing how the challenges associated with communicating One Health to stakeholders, especially in the animal health perspective. And our panelist for the discussion today is Dr. Chanchal Bhattacharya. He is a veterinarian who completed his bachelor's and master's in veterinary medicine from the Kharkov Zoo Veterinary Academy, Ukraine. He also holds a master's in veterinary public health from the All India Institute of Hygiene and Public Health, University of Calcutta, and a PG diploma in animal welfare from the Indira Gandhi Open University. Dr. Bhattacharya worked in the Sahasra Seema Bal, Ministry of Home Affairs, Government of India for 4 years before joining as veterinary officer and then working as Chief Veterinary Officer in the Animal Husbandry Department, Government of Delhi. He is also the Nodal Officer for Zoonotic and Infectious Diseases at the Animal Husbandry Department, Government of Delhi. Dr. Bhattacharya is also invited faculty in One Health at IIT Kharagpur and is a One Health expert. He also is a collaborative member of the Center for Public Health Research, Manbhum Anand Ashram Nityanand Trust. And he's a veterinary member of the Technical Expert Group for Climate Sensitive Zoonotic Diseases and One Health for the National Center for Disease Control, Government of India. He is the only veterinarian on that committee, by the way. His area of interest include animal health, zoonotic diseases, antimicrobial resistance, wildlife disease, biodiversity, climate change, and disease dynamics. Welcome, Dr. Bhattacharya, to today's discussion.
Thank you very much.
So just to give an introduction on the topic, One Health is currently the trending term in the environment and development sectors. But even now, very few people understand what the term truly means. The most common understanding is a very human-centric view that One Health is the interplay between animals, humans, and the environment. And this translates into action on zoonotic diseases and human health indices. However, our health is also affected by the health of everything that surrounds us. And this includes the animals that we share our space with, right? And you'd be surprised at how few livestock or pet owners themselves are aware or unaware of the health issues that they share with their animals or the health problems that they can have through owning livestock or pets. And in this webinar, we discuss this and other issues related to One Health and the implementation of One Health, especially in India, and the role of the animal health sector, especially livestock and pet owners in the same. So with that, I would like to ask Dr. Bhattacharya to give us a brief idea, since he's been working as a nodal officer of zoonotic and infectious disease at the Animal Husbandry Department in the Government of Delhi. Could you please share with us what that exactly means and what is the kind of work that you have to oversee as during your position?
Yeah, exactly. Actually, I started my career in Delhi in 1996 as a veterinary officer. So I have been working in different segments of animal husbandry and veterinary medicine in Delhi. Okay. Since 2014-15, I have been assigned to look after the zoonotic diseases and other infectious diseases of livestock origin. You see, the first time we have combated with zoonotic infections in Delhi in 2015, it is a Glendar's outbreak of equine. You know, Glendar's is Pseudomonas milli. It is a very dangerous pathogen which can kill human being also, and it can be spreaded to from equine to equine owners and through them to the society. So it is a very dangerous notifiable disease. So after the notification, you see, we have taken certain steps in Delhi. Basically, it is a multi-sectoral approach to combat with the disease, because you see, the main thing is that euthanizing the horses. And when you are going to euthanize the horses, there is a law and order problem, because no horse owner wants to give their horse to be euthanized, because
Right.
Government of India is promising to pay 25,000 rupees, but it is a lengthy process. And if you want to get this 25,000 rupees from as a compensation package, you have to fill a lot of forms. You have to give your bank account details like this, like this. Most of the horse owners do not have bank account at all, because they are poor people. So there are huge problems. So at that time, we requested Delhi police to intervene, because until we got the help and assistance from Delhi police, we could not capture the horses in a proper manner. After that, we requested MCD, Municipal Corporation of Delhi, to extend their help, because they are having big vehicles for cattle transportation. So they have deputed these big vehicles, and they are dog and cattle catchers to capture the animals. And after that, we have taken them in a remote isolated place where we euthanized the animals and buried them according to the international norms of burial. Okay, Government of India, Department of Animal Husbandry, Dairying, they have also issued guidelines how to bury the animal, so that no further infection will be spread in environment. So this is the first time I have combated with zoonotic infection. Again in 2016, you see, it was a real-time nightmare, because the avian influenza outbreak took place in Delhi. You understand that Delhi is our national capital. All the embassies are there, all the high commissions are there, all the international organizations are based in Delhi. So at that time, I was the nodal officer of zoonotic and infectious diseases, and you see, we had a huge problem at that time, huge problem, because a lot of foreign embassies, they are calling us. They are telling that the crows died, the pigeons died. So we had to rush there, and we had to take care of the carcass and bury them properly. So it is a very big problem, because we were not experienced at that time. Because when you are staying in a city like Delhi, it is a totally urbanized city. So combating with an urban zoonosis, it is a real challenge in front of ourselves. At that time, you see, the committee was formed involving all these stakeholders. And this is the first time when, since 2015 also, the medical department also started working with us. As an example, during the Glendar's outbreak, the medical department visited the equine owners, took their serum sample, blood sample, and analyze them whether anybody is having this infection or not. Same thing happened in during the avian influenza outbreak also in 2016. The medical department extended their help, and mostly the veterinarians and paravets who are involved in this operation, they were tested whether they are having avian influenza infection or not. So this is the first time Delhi has seen the multi-sectoral approach. You see, at that time, the One Health conception was absent in our country. But I believe that we are one of the pioneers in this segment. This is really a big challenge, but with God's grace, we have succeeded to make control and containment.
Glad you brought that up, because I would like to ask you, since you have a 30-year career as a veterinary officer in the animal husbandry department, and you must have seen this entire change in the understanding of this concept of One Health. And like you said clearly, I think we in India, especially living so close to our animals, have some understanding of this concept of One Health. But how do you think this entire landscape of One Health has changed in India over the 30 years that you have been practicing here?
Yes, you see, actually the concept of One Health was absent. When I started studying veterinary public health, you must be knowing about Professor William Schwabe, who was the father of One Health concept. You see, one medicine, one health is telling like this. You see, the concept of One Health was not very predominant in India. I started working with rabies control work in Delhi in 2002. In the year of 2002, at that time, I was usually inspecting the NGOs who were, at that time, government of Delhi usually gave them anti-rabies vaccine free of cost. My work was auditing whether they are using this vaccine properly for stray animals or ABC program like this. You see, so this is the first interaction of mine with zoonotic diseases. But today it is 2023, and 2020 is going to be completed within 2 months. So a long way we have worked in the path of zoonotic disease control in India. Okay. Earlier, zoonotic disease was nobody's baby. When we went to animal husbandry department, they are telling, no, zoonotic disease, you see, it is not our concern. Let the medical department will tackle. When we went to medical department, they told we do not have any idea what is zoonotic diseases. And when we are talking about tuberculosis, bovine tuberculosis or brucellosis, the incidents are very few. You see, Q fever is rather most prevalent in Himachal Pradesh or Uttarakhand, like this, you see, some areas. Then plague outbreak was there in Surat. So, you see, gradually the situation is changing. But I will tell you one thing, that in 2006, the first outbreak of avian influenza took place in Maharashtra. Then we were under Ministry of Agriculture. Our animal husbandry department was under Ministry of Agriculture at that time in center. Right now we have our own separate Ministry of Animal Husbandry and Fisheries and Dairying. So at that time, you see, people started thinking about the multi-sectoral approach for controlling this avian influenza, because avian influenza was such a disaster for India, such an economic disaster rather for India. Then people started thinking in a different manner, because when you are culling the birds in commercial farms, you need civil administration support and police support, you see, otherwise you cannot do the culling operation. So when these type of things are coming in front of you, then you started thinking about the multi-sectoral approach of controlling this disease control and containment, you see. Otherwise, alone animal husbandry department is not able to do this work. Yes, animal husbandry department is an implementing agency. In Karnataka also, you have seen the culling operation. A lot of culling operation has taken place in Karnataka. I have seen some of my very good friends who are working in animal husbandry department. They were directly involved in this operation, so I know what is what. You see, this is the first time we started realizing that approach should be different. And avian influenza is an eye-opener for us. But the total scenario has been totally changed after the COVID-19 incidents. Everybody is talking about One Health, but
everybody's eyes open.
Yes. Everybody is trying to put their hand in One Health, but a lot of people do not know what One Health exactly is.
Right. And I'm glad, you literally walked me to my next question, which was trying to talk about how do you identify your specific stakeholders. And from what you've told me now, I'm counting police, I'm counting the public health department, I'm counting, of course, the animal husbandry department, the agriculture department, then there's the farmers themselves, and all of the other associated departments that you're talking about. So that's really interesting. And I would like to understand from you, what are the challenges you face talking to all of these different stakeholders? How do you bring them to the same table and get them to work with you to deal with a One Health challenge?
Yes, actually, in 2020, there was a remarkable situation changed in Delhi. Our Chief Secretary took personal initiative to form committee under the chairmanship of district magistrates in 11 districts of Delhi. Okay. In these districts, the chief medical officer of the district, the chief veterinary officer of this district, then municipal corporation officials, veterinary department of municipal corporation, medical department of the municipal corporation, then NDMC, New Delhi Municipal Council people, public health department, then PWD. PWD is also involved. Police authority, the DCP of this district is also involved, and a multi-sectoral committee was formed under the chairmanship of district magistrate. And district magistrate was made the nodal officer for looking after the total operation. Definitely, the district animal husbandry officer, as an example, I was the district animal husbandry officer of New Delhi district, the most sensitive district in our country. Okay, where the PM house and our parliament and president house were situated. So I was made the nodal officer of this New Delhi district for under the chairmanship of district magistrate. Okay, not nodal officer but coordinating officer. I was coordinating with all the departments. So this is the first time I have seen that our government has taken lot of pain to resolve this problem, because already it was understood by everybody that until all the departments will not be involved, the problem cannot be tackled properly. You see, we used to get calls from PM house that inside the PM house there were carcasses, you see, of crows, pigeons, like this. So we had to take the help of New Delhi Municipal Council. They have their own veterinary hospital in Moti Bagh. So we have requested them to expedite all these things, to involve their sanitation worker, hygiene and sanitation worker, and their veterinary officers, like this. So it was a close coordination, you see, and we helped each other at that time, and because we understood that until we help each other, the problem cannot be solved. So right now the understanding is there, and right now we came to know that One Health approach is a very big approach, and it is a multi-sectoral approach. Alone, one department cannot tackle this situation.
Right. So maybe a slightly delicate question, but do you think that the departments were able to communicate and work together to solve, say, a common problem earlier than now that there is a formal setup or something like, now that there is a formal committee, One Health, and all of that? Is that impeding the work of departments working together, or has it actually become better now that this understanding is available?
Actually, right now it is much better, because earlier the understanding was not there. Understanding, right. As an example, intervention. What type of intervention the department will do, it was not clear. But right now the specific guidelines are there. And moreover, one thing I would like to point out, very recently we have opened our Center for One Health in National Center for Disease Control, okay, in department, in division of zoonosis, okay. That is a remarkable step in respect of One Health approach in India, and I appreciate the step of government of India that it is very encouraging. You see, actually, right now we have developed some model where intersectoral coordination will take place, and what type of responsibilities will be borne by different departments, it was already defined. Okay, so it is much easier right now.
Interesting. But so just coming from where I've worked with different departments, mostly in the south and also in central India, what I found is that, like, at the district level, which is where we work, at the village level, when we are talking to them about, say, information on a zoonotic disease, it's very siloed. So the animal husbandry department has its data, and the public health department has their data, and the forest department has their data. And then there is no space where all of this data is shared and analyzed as a whole, under the One Health framework. It's all like each of them look at the data and analyze it under that. So do you think that kind of a setup is now changing in the country? Are we going to go towards something like that, yes, where data can be shared?
Here, I just wanted to give my inputs. Actually, for the last 2 years, I have attended a lot of high-stake committee meetings in Government of India, you see. So there we have suggested to create a common portal under Ministry of Health and Family Welfare for data sharing. Okay. As an example, every ministry or every department in state level has their own data analysis system. But there is no common portal where all the departments should share their data. Because as an example, I do not know what type of data is generated by Department of Environment and Forest or in Delhi state. I don't know until I am getting in touch with them. I don't know what type of data is generated by Public Health Department. They
Right.
do not know. They do not know what is the basic data system of animal husbandry department. So until we are not preparing a common portal, common virtual portal where all the department will share their data, it will be very difficult to assess the ground reality, the situation. You see,
Right.
because when we are sharing the data, only then we can understand that what exactly the threat, what the threat is lying. You see, the threat
Exactly.
called risk factor. It
Right.
will be easier to identify the exact risk factor from where the risk is originated. The risk communication, then first risk communication will be coming, and then we will think about risk management. Okay, the control containment part. So this is the absolute necessity, and I have made it clear in a last stakeholder meeting, and Honorable Director General Sir of Ministry of Health and Family Welfare, he agreed with this that a common data sharing platform should be there, and already National Center for Disease Control is working on that, and within a very short time, I think that things will be solved.
That's wonderful. I think that would go a long way to
Mm.
even predicting when there might be a chance of outbreak into say humans or vice versa. Reverse zoonosis from humans to animals. If there is a chance, you get that advanced information.
Another one thing I would like to inform you that we have a system under central government. It is called IDSP, Integrated
Right.
Disease Surveillance Project. You might be knowing
Right.
about it. And
Right.
right now, the central government, Ministry of Health and Family Welfare, made it mandatory that at least in district level, one veterinary officer should be made a member
Right.
of this district genetic disease committee.
Right.
That is a remarkable step. That is a remarkable step. And this veterinary officer should be responsible for all genetic diseases outbreak and data collection, then different steps. Okay, so this is a very positive step in my opinion. You see,
Right. That's really interesting, and I'm very happy to hear that the government is, thinking of all of this. I request all the viewers to please put your questions in the chat, and we will get to them at the Q&A session in the last 15 minutes of the webinar, so that we continue the flow of conversation. My apologies, please. Yeah. So I was saying that, you were talking about when you were looking at glanders and you were working with equine owners and even with the avian influenza, going and telling a horse owner or a livestock owner or even someone who's running a poultry farm that you have to cull your animals, that's not going to be easy, and I'm guessing that it's not a very pleasant interaction to have. So that's something I'm very curious about, and I'm sure our viewers are too, about how at that point, how do you communicate to them the importance of what you're doing and why it is needed, and what has been some of the reactions that you've received, like have people been receptive to what you're telling them?
basically, you see, when we are dealing with the farmers, you see, we need to have a participatory approach. Okay, a two-way communication. If you are telling, but they do not understand, then it is
Right.
pretty useless. Another one thing, when you are working as a veterinary surgeon or veterinary officer, as an example, I worked as a veterinary officer in ground level. Always I tried to win over the psychology of the farmers. I always made them clear that I am their friend. And when they are in disaster, I will stand by them. So if I can make this type of report with them, then this next step will be easier. As an example, during the outbreak of glanders, I worked in this bank of Jamuna. Okay. In Madanpur Khadad, I was posted in Madanpur Khadad area in Sarita Vihar, which is very nearby from Jamuna. And I
Right.
worked in Okhla area,
Oh,
where
okay.
it is thickly populated with equids. Okay.
Right.
I personally visited the equine owners. I personally intervened with them. I requested the political leaders to extend their help. I requested the influential people in villages who are creating impact on the society. I involved them all, and I gathered them all, and I explained the situation, that these are the situation. Now you tell me what is to be done. This is the guidelines of Government of India, but until you are cooperating, I cannot do anything. I cannot force you to take your horse if your horse is
Right.
positive, to kill them. Then we started explaining that you will get 25,000 rupees and these are the procedures. And immediately we'll take necessary action for filling up the forms, etc., etc. So the main thing is you have to win over the confidence of the farmers. Same thing happened in avian influenza or other zoonotic diseases. You see, you must understand their psyche, because when you are a owner of a poultry farm or cattle or buffalo or horse, you see, it is not so easy to give your animal for killing. Okay.
Livelihood also.
Even as a veterinarian, I also do not like to kill any animal, you see, for the sake of our society. But it is, I am compelled, because I am compelled by law of our country, so that if the notifiable disease is there, we have to kill the animals. There is no alternative. But the main thing is, you see, you have to be passionate to your society. You have to be passionate to your farmer friends, and you must apply the participatory epidemiology approach. Participatory approach, we have been taught in epidemiology, you might be knowing about it. So this is very important to see.
I really appreciate that. I'm glad you brought that out, and I think this is important for a lot of practitioners, not just of One Health, but any approach that we use with communities when we go there. It has to be a two-way thing. It should not be we telling them and then expecting them to accept it, but rather also listening to what they have to say and then trying to see if we can find a middle ground. I think that's a very great point that you brought out. Having said that, have you in your your interaction with the owners, livestock owners, have you come across a situation where when you explain to them maybe the potential of a zoonosis and the risk to their own health, that has not mattered to them as much as, say, the fact that there'll be a compensation, a monetary compensation? Has that been ever, or have you ever seen that, yes, the monetary compensation is what changes their mind rather than the threat of a zoonosis?
No, not exactly. Actually, it is your skill, how you make them understand what is the threat of zoonotic diseases. Okay, it is your skill. Because if you are using a lot of big words and a lot of technical terminologies or molecular explanations, they don't understand, because they are basically illiterate people. You see, you have to put yourself in their level to make understand what type of language they can understand. You should use this language. You should use their emotions. You should explain them that what is the threat perception is lying from this disease, and even they can die from this disease also. Only then they will realize, they will understand. Otherwise, only money is not solving the problem. This is my personal experience, because I have worked in grassroots level for a very, very long time. And right now, definitely I'm a policymaker. Right now I'm holding a different charge. But you see, I love to work with people of my country. And you see, if you are trying a little bit, they will understand. Definitely. I'm not telling that 100% people will understand. Maybe 85% people will understand, 15% people will be reluctant. That is my experience. It is happening in everywhere.
Right. Have you ever had, an instance where things have not exactly gone your way? We would love to hear something, some interesting stories from your field work.
Yes. Obviously. You see, during Glendar's outbreak, we visited some place. Okay. It is in part of my area of operation also. We visited this place. We were 4. Myself, another one veterinary doctor, and 2 para-veterinary staffs. We went there by my own vehicle. We did not have an official vehicle at that time. By my own vehicle, I drove this car. So we parked this car, and then there were positive Glendar's horses. We wanted to discuss with the owner. The owners were so reluctant. They do not want to listen anything. Even they do not let us go out of this place. They encircled us. They told us that they wanted to break my car like this. So it was a very horrible situation, but somehow somebody called the police. The police came and they intervened, because the police people know me personally because I was working there, and there was an order from government of Delhi that this type of things are there, and the police people should collaborate with us. So they have saved our life on that day. It was a very difficult situation, you see.
Right. So that's the, I would say, common man stakeholder. Let me ask you a bit more sticky question about, stakeholders in the government. Sometimes you have to convince people in the government to cooperate with you, or even in departments. Have you come across situations where that was a challenge, or where
This
you
is
had
very
to overcome that?
this is very common. You see, this is very common because all the stakeholders are not cooperative. Some of the stakeholders decline. When you are approaching them that this is your work, please do it. They told no, we don't have machinery, we don't have manpower, we are not able to do it. They simply reject. You see, then it is a challenge. Really, it is a challenge that you have to convince other people. Maybe they are higher ups or maybe they are juniors to make this work happen. You see, it is not so easy.
Right.
We are facing this problem. But right now the situation is changing gradually because all the stakeholders started understanding that what is the importance of One Health approach.
Right. I think this is great because I hope our viewers also have come to realize how challenging it is to work in the animal health sector, especially when you look at zoonotic diseases and diseases that might affect society. Because in the human health sector, if someone is sick, you can just take them to the hospital, put them in quarantine, whatever it is, and things are taken care of. But in the animal health sector, it's not just the animal and the animal owner, it's all of these other people like the police, like Dr. Bhattacharya was talking about, the other governmental departments, the sanitation department. You need someone to transport the animals. Are they going to be willing to do that? Then you have to take them to the place where they will be, euthanized, getting their cooperation, all of this. A lot of things have to fall into place and a lot of other actors are involved. So I think this was great that you had given us this overview about how so many different actors and stakeholders are involved when we talk about One Health. It seems very easy. Here you have animal health sector, you have the human health sector, and they can work together and solve problems, but it's not. It's much more challenging on the ground. And I'd like to, with that, I would like to ask you, what do you think is, first, the challenges that are facing us now in terms of communicating One Health to the common man, first of all, and secondly, how can we improve this communication? I know you said participatory epidemiology, but that is when you're actually dealing with livestock owners. For example, during the COVID-19, trying to get people to understand, not just about how the precautionary measures they had to take, but the whole concept of, this is coming from animals and it is infectious. How do you deal with that? How do you communicate this better to your stakeholders?
Yeah, actually, you see, as a veterinarian, the real challenge is human-animal interface in ground level. Okay, because you see, in India, if you are visiting the villages, you must be seeing that in most of the households, people are keeping some type of livestock. Okay,
Right.
and in most of the cases, no hygiene sanitation system is existing there.
Right.
Practically, they are not following any hygiene sanitation system, so they are prone to zoonotic pathogens. Okay, the
Right.
pathogen can be transmitted very easily to human being. So you see, actually, in my opinion, that what I did, I can personally explain you that whenever I have visited some village, I started communicating with the local people. I started informing that I am coming on that day, and if there is a Kishan Gosti like things that can be happened, it is very good. I will explain them some basic hygiene and sanitation procedure, what they should follow in respect of their animals, because always there is a threat perception that the zoonotic pathogen can be transmitted from animals to them. So you see, if you take a basic measure for preventing zoonotic pathogens, you can be succeeded up to some extent. Another one thing I will tell you here, that in last stakeholder meeting, we have discussed the role of ASHA worker. Okay, the Anganwadi and ASHA worker. Okay. As far as my knowledge is concerned, during COVID-19, they played a very significant role
Yes.
in respect of villages in our country. Okay. So
Right.
I floated a proposal at that time in a stakeholder meeting. I floated a proposal that if they can be taught about the basic things of One Health concept in our country, and if they can be involved in grassroots level to teach the local people about the basic animal health precautionary measure and basic zoonotic disease precautionary measure like this. I don't know that whether the proposal will be implemented at the highest level or not. But you see, this type of workforce can be prepared in our country. Here, I just point out that in 2005 in Africa, when there is a huge outbreak of rinderpest, okay, the cattle plague, rinderpest, then the participatory approach has been implemented in different countries of Africa under the uh, guidelines of ILRI, International Livestock Research
Right.
Institute. Okay. So then the village level animal health workers started working in
Right.
Africa, and they started making people aware about different
Right.
measures how to control rinderpest infection like this. You see, and it was a very successful program. And after that, the participatory approach of epidemiology has been established in veterinary medicine. Earlier, it was not. So
Right.
if we are uh, able to create a workforce of in this line, I think that it is the necessity of the time.
Well, I'm glad you brought that up. In fact, CWS just concluded a very successful conservation program under the leadership of our executive director, Dr. Pritik Karan. This was called Wild Suraksha. And under this program, we trained, it was a TOT, training of trainers. So we trained Asha and Anganwadi workers, frontline staff, and some of the forest department workers, and even police officials on zoonotic diseases, and these were mostly people who are living in the forest, in villages around the forest. And this was done in 69 reserves in the Western Ghats. So we did about 10,000 workshops and reached out to almost 2.5 lakhs of workers. And it was really interesting. They found it very useful. We taught them about what is a zoonotic disease, what are the diseases, how do you, especially when, because they encounter wildlife a lot. So how to avoid these encounters, what do you do if you encounter animals, in case of snake bite, in case there is a dog bite, in case you have an accident. So it was really appreciated and well received. And that was one of the most successful programs that we had run. And for our viewers, if you're more interested in learning more, you can visit CWS website to learn about the Wild Suraksha program.
I know about your program. I am quite well aware about your activities, and I am feeling grateful that you have undertaken this type of programs. And you see, I would like to emphasize on outreach program of community. This is
Right.
very important, because you see, momentarily you cannot achieve all these things of One Health.
Right.
So you must start from the ground level, and for that we need outreach programs. You see, and only government cannot do it, but other
Absolutely.
stakeholders like NGOs, like international organizations, they have to collaborate with government, and they have to work by their own. There are a lot of organizations in India, like your organization, like Center for One Health, then Hyper International. You see, they are doing very good work. They are
Right.
doing very good work. Mott McDonald, you see, that's
Right.
British government organization. They are doing very good work in grassroots level. I know
Right.
personally, because I came across with the work. As an example, USAID has a very huge program. We through different organizations, you see, in
Right.
grassroots level. These are
Right.
the real works. These are the real works which we need. Our government is doing excellent work also, but the job is not only a responsibility of the government, but other stakeholders should come forward.
I'm really glad. I think that's a great note to leave our audience on. And with that, I think I would like to open up the Q&A session, because I see a lot of hands that have come up. So I would
Yes,
like
yeah,
to
please,
open up
please.
to the audience. Please do put your questions in the chat, all of you, and then I can give them to Dr. Bhattacharya. So here's one question from Pradeep Panda. It says, I am wondering why not farmers are encouraging for the vaccination rather than killing the animal. So if you would like to answer that.
Yeah, actually, when there is an outbreak, of these notifiable disease, only the killing question is arising. In case of avian influenza, we are not doing any vaccination in our country. This is a policy matter. I can't comment on that. I can't. I'm not an absolute expert on that. So this is a policy matter, and our government is dealing with that. So we are not doing any vaccination in respect of avian influenza. Okay. So then the culling question is coming. In place of glanders also, you see, glanders outbreak is common in some sporadic areas of our country. It is not happening in everywhere. Okay. So whenever there is a necessity, only then we are culling. But sometimes you see in some cases, vaccination is not at all possible. Only then the question of culling is coming.
Right. I'd also like to clarify that vaccination usually is effective before a disease happens. Once disease happens, vaccination is not useful. And in the case of, like Dr. Bhattacharya said, notifiable zoonotic diseases, these are zoonotic diseases that are considered so dangerous to human health also that you have to notify the World Organization for Animal Health about it. And then that means that you have to take every step to contain that disease. And mostly in the case of animals, it means killing that animal because there is no other way to stop that infection from spreading.
Basically, as an example, glanders. Glanders is a bioterrorism weapon, you see. Right. So we have to think about it, and we have to take this matter very seriously. So that is why the culling takes place. Nobody wants to kill our animals.
Right. And it's not fun. Even, we are vets, but any animal that dies is very hurtful and very difficult.
You see, I'm a doctor. I'm saving the life of animals. I am not supposed to kill the animals.
Right. Here's another. So, okay. So Pradeep Panda is following up that his question is then why not encourage vaccination before a disease happens?
You see, there are certain diseases the vaccination cannot be taken place for that. You see, we are doing what type of vaccinations we are doing? We are doing foot and mouth disease vaccination in cattle, or buffaloes. We are doing hemorrhagic septicemia, then black quarter. You see, there is a policy when you are doing some vaccination from government level. There is a policy, and vaccination is a policy matter. Overnightly, you cannot change this situation. So there are certain diseases for which vaccination may not be possible. You see, vaccination may not be applicable. So only that things are there. But definitely under National Animal Disease Control Program, NADCP, we have undertaken the rigorous vaccination procedure of foot and mouth disease and brucellosis in every state of our country. And the state governments are providing hemorrhagic septicemia vaccine, black water vaccine. Right now for LSD, lumpy skin disease, we are using goat pox vaccine. So vaccination is there, definitely.
Yeah, and also it's the same as during, there are vaccines available, and the department and the government, offers a lot of this free of cost to many or most of the farmers. But it's like the COVID-19 vaccine, you knew it was important for you to take the vaccine, but still so many people did not take the vaccine, right? So there are so many reasons why livestock owners, even pet owners, many pet owners don't get their pets vaccinated because they just don't think it's important enough, right? Or they don't want to spend the money on it. So there are multiple reasons why they may not get their livestock or animals vaccinated. That's a challenge as vets everybody faces all the time. And yeah, we need more people like you who will go out and spread this information that vaccination is important even for animals because it affects animal health as well as human health. So definitely that's important. Please do encourage people to vaccinate their animals also. So going to the next question, this is Smriti who's saying, I'm a master's student of zoology. I just wanted to know if a person in the field of zoology could help or enter into the sector of helping people become aware of zoonotic diseases.
Obviously, zoology is an integral part of One Health. You see, you are dealing with the animals. So after pursuing your masters, you can easily come into the field. That's not a problem. You can go to different aspects of One Health. You see, you can do genetic research on zoonotic diseases. You can go for wildlife diseases like this. You see, so there are a lot of scopes. Definitely, she can come forward.
Absolutely. Then there's another question from, I don't know who this is from. How effective has awareness drive on One Health helped in the management of One Health? That's one
This is
question.
this is this is one of the most important thing what I have already discussed. You see, it is our duty as a stakeholder or as an expert. It is our duty to make our society aware about the importance of One Health. Gradually, it will happen. Overnightly, it cannot be happened. Okay. Again and again, we have to hammering up our people. Only then they will realize what is the importance of One Health. And you see, when we are talking about One Health, there are different segments. There are animal health aspect, there are human health aspect, environmental health aspect, agricultural aspect, fisheries aspect, biosecurity aspect. So many things are there, you see. So gradually, we must address all these things and make people aware what is the importance of every segment of One Health.
Right. Avantika asks how far the One Health concept has gone in terms of policy. Like the other countries like Rwanda and Bangladesh, they have incorporated One Health into their action plan. So, will it be possible in India and by when? Do you have any idea of the journey or initiatives done from the human health sector?
Yes, actually, One Health concept has already been happened in our country. In 2021, we have introduced National Rabies Control Program, which is absolutely based on One Health concept. And right now, National Rabies Control Program is happening in every state, almost every state. In Delhi, also, I have prepared the state action plan, and already we have submitted this action plan to National Center for Disease Control. And you see, when you are preparing an action plan, every department has their stake. The human health, human health, public health department, and animal husbandry. Both of them have equal responsibilities for the rabies eradication. So already this is happening in our country, and our government has given a lot of emphasis on that, and the from different top level policy makers already the guideline is existing.
Dr. Bhattacharya, I think she's asking more in terms of a specific One Health action plan, not just about a specific disease, but an overall One Health action plan which allows.
One Health action plan is already introduced by Ministry of Health and Family Welfare and Department of Animal Husbandry, Dairying and Fisheries, Ministry of Animal Husbandry. Okay, actually, Ministry of Animal Husbandry has got $25 million recently from World Bank for controlling the pandemic originated from animal origin, and it is based on One Health approach. And already the pilot project has been started in 5 states. And the CII, Bill and Melinda Gates Foundation, and Ministry of Animal Husbandry, they have 2 states under their shoulder. This is Uttarakhand and Uttar Pradesh, where they have already started the pilot project, and the implementation part is already taken place.
Right. So I'll come to the next question. That's from, Avantika is again saying, I'm working on a manuscript on One Health, but I'm not able to find much policy documents. So right now, there is no One Health action plan as such. Each department has One Health aspect put into their specific action plans currently. But India is currently working on, like Dr. Bhattacharya just mentioned, the One Health Committee has been set up, and they are now going to start working together to build the policy and also build the plan, and then bring into effect things like data sharing. I don't know if you missed that part of the talk, but also data sharing platforms. Yes, sir.
One thing I will tell her. I will tell Avantika that our principal scientific advisor or PMO has issued a general guideline for One Health implementation. Okay, she can access this document in internet, through which she can understand what exactly we are going to do in India from government sector. Okay.
That is available on the website of the principal scientific.
Yes, it is available. It is easily available in internet.
Right.
If she can Google it, she can have it.
Okay. So Gautam asks, what measures can be taken on a farm or in a livestock setting to prevent zoonotic disease transmission to humans? Wow, that's a big question, but
it is a big question. Definitely, I am advising them to do the vaccination properly. Okay, the vaccination is a proper measure, because if you are combating with antimicrobial resistance, vaccination is must. Then the number two, the second number one is hygiene and sanitation of the farm premises. Okay, the workers who are working in the farm, they have to take the basic hygiene and sanitation measure. They have to change their clothes, they have to change their shoes, and when they are going inside the farm premises to work, they should not be in touch with outside people. Okay, so that cross contaminations cannot be taken place. And when they are milking the animal, they will have to take the udder health properly, udder hygiene properly. Okay, the milking utensils should be very clear, very properly washed with caustic potash or other detergent, you see, regularly. Then you see, biosecurity measure. Biosecurity is very important. Advisably, when you are establishing a farm, the farm should be, you see, segregated from locality. It should be in preferably in an isolated place. Even you should undertake some measures so that the scavenger dogs should not venture inside the farm. So these are the basic biosecurity measures which you should take care of, you see. But it is a very vast subject. If I keep talking, I will have to talk hours.
Yes, there are lots of documents and guidelines available online if you want to look, even on the website of the World Organization for Animal Health and WHO, and lots of other international organizations actually.
FAO also.
FAO. I'll come to the next question from Uma. There is outbreak of parvovirus in Western Tamil Nadu. What steps are required for the control?
Parvovirus.
Yes.
Parvovirus basically happens in dog. Okay.
Right.
Canine parvovirus. For that, you have to vaccinate your animal. Actually, at the age of 45 days, you must start your vaccination. There are vaccines called DHPPIL, the multivalent vaccines, which has to be given to the pup at the age of 45 days. Then again, you have to repeat this vaccine after 21 to 30 days. And the third shot is also accordingly. And every year, you have to vaccinate your dog. Only then you can prevent the parvovirus vaccine, because parvovirus is a very fatal disease. And right now, there is a new strain in India, which is very, very virulent.
Amresh asks, how far are spillover chances from small mammals studied in India?
What?
How are there studies that have looked at spillover chances from small mammals in India?
Small mammals means small ruminants. I think that he means small ruminants, or in generally total mammals. If we are talking about total mammals, you see, I have not much idea about wild mammals. I can explain only in case of sheep and goat, okay, which are extensively practiced in our country. The husbandry is extensively practiced. So you see, in case of small mammals, definitely there are zoonotic threats, like you see, tuberculosis or brucellosis. Brucellosis is a very virulent pathogen which can be originated from goat and sheep. So you must take basic measure when you are consuming the milk from these animals. Pasteurized milk is advisable. And the basic vaccination practice and hygiene sanitation practice should be followed properly.
In terms of wild mammals, not much has been done to study spillover work. It's a very complicated process getting permissions from the Forest Department to do any sampling study, invasive studies, which are required for this kind of work. So I'll move to the next question, where they're asking what are the reasons which hampers the elimination of rabies in India?
You see, this is a very complicated question. Rabies is not only a clinical disease, but also is a social disease. You see, the main thing is that stray canine management, it is a very big problem in India. Stray canine management, we are not able to do it in a very proper manner, because you see, our ABC program, Animal Birth Control Program, is going on for a long time in our country. But according to WHO guidelines, you have to neuter at least 70% dogs in a particular geographical area simultaneously for 5 years. And accordingly, after neutering, you must do the vaccination. Okay. But sometimes we are not able to achieve this 70%. And if we are not able to vaccinate at least 70% dogs in a particular geographical area, it is very difficult to control the canine originated rabies. We are working on that very vigorously because of that, the National Rabies Control Program has been launched in 2021, and all the stakeholders are very actively involved. We are trying our level best to eradicate rabies within 2030 in India.
Right. Final question, and this will be the last one. We're already at time limit. Is what data are you collecting? Uma is asking, what data are you collecting? I don't know exactly what data she's talking about. She or he.
Data, you see, as an example, in Animal Husbandry Department, we are generating data. As an example, disease surveillance report. Every month, we are generating a disease surveillance report. In which hospital, what type of diseases are seen, and it has to be documented, and we have to forward it to Ministry of Animal Husbandry, Fisheries and Dairying. Okay, this is a data collection system. Okay, the statistical department is working on that, and simultaneously, the Northern Disease Diagnostic Laboratory in Jalandhar, they are asking data from us also, and we are providing data to them. In Animal Husbandry Department, this type of data are generated, and in medical and public health department, they are also generating data according to their treatment base or outbreak base like this. And you see, these things are happening in every department. Data generation is there.
Okay. I think that was the last question. I'm sorry, it's kind of late. I cannot take more questions. We're already over time now. I thank you very much, Dr. Bhattacharya, for a wonderful, wonderful session. Very insightful and very, enlightening. Even I learned a lot from our discussions today, and I hope our audience did too. As just a reminder, I would like to tell the audience that our young scientists, as I mentioned, are studying a broad array of species from mammals, birds, reptiles, amphibians, and other wildlife, as well as the human dimensions of conservation. We are currently undertaking a fundraising challenge under Dana Mojo, and the challenge is to raise 30 lakhs by November 17th, 2023. So please support us, help raise this fund so that they can continue their important conservation research. If you'd like to know more, the link has been given in the chat. And you can also go to our website, cwsindia.org, check out where you can support. With that, I would like to thank Dr. Bhattacharya very much for honoring us with this, with your presence here, with all of the insightful information that you've given. Like I said, not every day we get to talk to someone who's serving in the government and who's at the frontier doing One Health implementation on the ground. So really interesting, and thank you very much for talking to us.
And last but not the least, if you need any assistance from my side, always welcome. Please ask me questions. I will try to satisfy you in my capacity, definitely, not beyond my capacity. So always welcome. I'm a very receptive person, and I'm a workaholic. I love to work, and whatever work you are doing, this is a real-time need for our country. You see, I'm really grateful to you. And Smith, someone is asking that how they will connect me. So you give them my email number, and
absolutely. He's also you can also find him on LinkedIn if you're on LinkedIn. Otherwise, yes, you're welcome to write to me, or you can contact CWS Outreach at cws.org.
Yes. You can forward me their queries. I will try to satisfy them. Okay. They are all. Thank you very much.
Thank you very much, everybody. Okay. Have a good night.
Good night.